24 by 7. I welcome you to our public awareness program on current management of NAFL and NASH. NASH 24 by 7 aspires to bring best-in-class education and awareness program to serve healthcare workers, patients, and their caregivers. Today, we have the renowned gastroenterologist from Indore, Dr. Ravindra Kale. He needs no introduction. However, I would fail my duty if I don't mention them. Dr. Ravindra Kale is a leading gastro in Indore, providing comprehensive and compassionate care to many patients for various gastrointestinal and liver conditions. He has experience building a clinical skill set that allows him to deliver patient-centric care. Currently, he is associated with Care Hospital at Indore as a senior consultant. Sir, we salute your dedication to spreading awareness related to liver health. So with this, now I invite Dr. Ravindra Kale to enlighten us on topic NASH Unravelled, the diagnosis and treatment of Demystified. Sir, over to you.
Good evening, everyone. Thank you, Dharmenji, and thank you, the team Zydus, for allowing me to give me a good opportunity to interact with you people. So today I will discuss about the NASH, or what is now called as MASH, metabolic associated steatohepatitis. So as you know that liver is the second largest organ of human body with an average weight of about 1.5 kg, and it contains about 5%, less than 5% of fat. It is located in the upper right hand portion of the abdominal cavity on top of the stomach and intestine, and it is normally soft in consistency. There are, as contrary to the normal people's belief, liver has many functions that include destruction of old RBCs, processing of nutrients, regulation of the blood composition by making clotting factors, producing bile, detoxified the blood by removing the toxins from the blood. It breaks down the alcohol and other toxins. Also, it takes part in the storage of nutrients like vitamin A, vitamin B12, and vitamin D. Non-alcoholic fatty liver disease is a condition in which fat makes up more than 5% of the weight of the liver, and which is not caused by the alcohol use or any other viral infection or other infection. This may be a serious condition, and if left untreated, it can progress to what is known as non-alcoholic steatohepatitis or metabolic associated steatohepatitis. So, what are the risk factors? If you are obese, overweight, having type 2 diabetes or high cholesterol, then you may be at risk of non-alcoholic fatty liver disease, or in simple language, fatty liver. So it's a very prevalent condition, common condition, and about 25% of people are affected with fatty liver. But if we see, then it is more common in the diabetic and obese people. If severely obese, the 9 out of 10 have NFLD. Also, male gender has been associated as a risk factor. How it progresses? You can see healthy liver that get deposition of fat, then it is known as fatty liver. That is innocuous, but sometimes it causes release of certain factors which lead to liver fibrosis, scar tissue forms, and more severe liver injury occur. If this injury continues for years, then the liver gradually become scarred, and this is known as cirrhosis of the liver. Cirrhotic liver is not able to function properly, and patient may develop accumulation of the water or ascites in the abdomen. Because there is some difference between the simple non-alcoholic fatty liver and NASH patient, NASH is more prone to cause further scarring of the liver, while simple NFL may not lead to further problems. So NASH is more important because it is associated with inflammation. Main causes we have discussed: obesity, maybe because of genetic background, food intake, then something known as metabolic syndrome. That is, if your waist size is more, if you have diabetes, blood pressure, or abnormal lipid profile, then it is known as metabolic syndrome. And these people are having higher chances of developing NFLD. There are certain medication which can also cause fatty liver, and like steroids, certain anti-cancer drugs, and physical inactivity also contributes. So it is seen that those people, particularly those who are in sedentary job, they have more chances of developing NAFLD. Too much obesity causes fat to deposit everywhere and also in the liver, and this lead to NASH and scanning of the liver. The association between NFLD and diabetes mellitus is there. There is threefold increased risk of death due to cirrhosis in diabetics. There is increased risk of NASH, and on the other hand, the fatty liver patient have high prevalence of diabetes and they have high risk of developing diabetes. So both way it is true. Now coming to NASH symptoms, usually it doesn't have any symptom, or people may complain of mild fatigue, discomfort or pain in the right upper abdomen, or there may be buildup of ascites in advanced liver disease. Then it may lead to confusion, decrease in appetite, easy bruisability, unexplained weight loss. These are the symptoms which advanced liver disease uh, occur, then these symptoms may be there. Fatty liver is a silent killer because there are no specific symptom. It's a very gradual uh, progression, and it is also associated with several other diseases like diabetes and heart diseases. So uh, it can be diagnosed very easily by, excuse me, can be very easily diagnosed by blood test, ultrasound or fibroscan, liver biopsy, and in some cases it may require doing MRCP, MRI or X-ray. Most common derangements, and because blood tests are usually routinely done in some of the patients, and they found that their SGPT and SGOT, these are liver enzymes which are as increased. But patient with normal ALT level can also develop progressive disease. Up to 80% of NFLD patient can have normal ALT. So there is no cutoff for ALT in NASH or NFLD. So there are other test designs, and they contain various criteria for diagnosing early this presence of fibrosis. And some of these score are FIF4 score, which contain age, AST, ALT, and platelet count, or NFS, NFLD fibrosis score, which has component of age, AST, ALT, platelet count, BMI, fasting sugar, and albumin. These tools are available online, and you can calculate the score from these, and they may suggest presence of fibrosis or absence of fibrosis by calculations. Then there are certain non-invasive tests. Ultrasound is usually the most easily available, and there are criteria for grading different levels of fat into grade 1, 2, or 3. The importance of ultrasound is that it is very easily available, economic, and usually when the patient goes for just a general checkup, it is the usual test which first detect the NFLD. But there are problems with ultrasound that it detects NFLD only if the fat is more than 25%. And as we know that any fat percentage more than 5% is NFLD. So lot number of patients cannot be diagnosed by doing just ultrasound. Also, it cannot differentiate between fat and fibrosis because both can be seen similar as a heterogeneous echo texture of the liver. Then there is another test which is now routinely available with the gastroenterologist, and this is transient elastography or fibroscan, which in simple word find the hardness of the liver, how much hard the liver is there. So, and also it calculate the fat percentage in the liver. So it is also like ultrasound, it is very easy to operate, but in obese patient there may be misinterpretation of test. Then also in certain condition like acute hepatitis, this test may be misleading. This test uh, has two types of values. One is LSM or liver stiffness measure, which indicate the degree of fibrosis or scarring in the liver. And another test is CAP or controlled attenuation parameter, which indicate the degree of fat in the liver. The another test is MRI PDFF, proton density fat fraction in the MRI. It's a gold standard to detect fat content, but the problem is it's cumbersome in some patients who cannot get MRI, those who are claustrophobic, and also it is very costly, not widely available, but it can detect very small amount of fat content. So that is advantage. Then the gold standard for diagnosis is liver biopsy. The advantage of liver biopsy that it diagnose the NASH and differentiate between simple NFLD and NASH. It can also detect the fibrosis. It can rule out other causes of liver disease. So it's a very good test, but problem is it's a painful procedure. It is individual dependent, and different pathologists may report the biopsy finding differently because of some inter-observer error. And early stage of NFLD, it may lead to misdiagnosis. And how this disease progress? Initially, only simple fat deposition occur, which is NFLD. About 70 to 75% have only isolated fatty liver or fatty liver with mild inflammation, and that usually do not progress much, and there is no increase in death in these uh, patients in comparison to general population. However, about one-fifth to one-fourth of these patients, those who have NFLD, that is 20-25%, they progress to NASH, and this NASH lead to cirrhosis in around 11% of patients over 10 to 15 years, and then another 5 to 7 years, they may lead to SCC in about 7% of patients. Those who have cirrhosis, about 20 to 40% of them may deteriorate and develop decompensation over next 7 to 10 years. So they have increased risk of death NASH patient, they have more of the death are related to cardiovascular causes rather than liver specific. Other causes are malignancy. The NASH with fibrosis have worse prognosis. So it is important to act before it is too late. NASH is a very serious problem of form of NFLD, and severe NASH is not reversible. So it is better to start treatment early. And the most important part of treatment is about taking good amount of vegetarian food which contain vitamins and fibers, and less amount of fat, alcohol, any addictions, and new medications. Also, one should exercise daily or at least thrice a week so that he did not develop fibrosis. Most important thing is control of weight gain. So low calorie diet, moderate intensity exercise, weight loss of around 3 to 5% case body weight helps to improve steatosis, while 7 to 10% will reverse the histological features of NASH. So uh, about 10% of weight loss is usually recommended for these patients. Similarly, similar thing we have given in this pyramid, that most of the patient are of the steatosis group, and in those patients about 3% weight loss can reduce the steatosis. However, the fibrosis one are on the top of the pyramid, and these require weight loss more than 10% for resolution. What is healthy diet for healthy liver? There are different types of dietary regimen, and Mediterranean diet is found to be very useful for healthy liver, and it is mainly consist of most of the veggies. Then types of exercises, one can do aerobic exercises, resistance exercises, yoga, and meditation. Aerobic exercise reduces liver fat, it maintains healthy weight, and improves the cardiovascular conditioning. On the other hand, resistance exercises reduces the liver inflammation, improves glucose absorption, insulin sensitivity, and improves metabolic parameters with less energy consumption. That all lead to normal liver. So, what are the lifestyle tips to tackle NFLD NASH? Develop an exercise routine and stick to it. That is more important. Get enough sleep. Around 6 to 8 hours of sleep in the night. Appropriate time is very important. Then get enough vitamins and minerals. Regular medical checkups, particularly those who have family history of diabetes, those who are obese, those who are on certain medication, they should get regular medical checkup, including ultrasound, to look for fatty liver evidence and derangement in the liver function test. Also, in diabetics, small frequent meal uh, help, and sugar intake should be decreased. What are the drugs available for NASH? As you know that diet and exercise, these are the first and foremost thing to be applied, but it has been seen that around 20% of people stick to this regimen, and most of the people, they develop progression in the liver disease, and they require drugs also. There are three molecules which are approved for this NASH. These are pioglitazone, saroglitazar, and vitamin E. And pioglitazone is a very old diabetic drug, and it can be used in patient of NASH with or without fibrosis in both diabetic or non-diabetic patients. But the side effect here is lot of weight gain and edema of the feet and heart congestive heart failure. Then vitamin E is uh, used in the non-diabetic adult, can be used in a pediatric patient, and similarly, it has been used in trials for up to 2 years. The There is small risk of increase in bladder and prostatic malignancy. Then there is new molecule saroglitazar, uh, which can be used in both diabetic and non-diabetic patients. The importance is that saroglitazar has very minimal side effects. So that is a good molecule. It also improves the glycemic control in these patients, and it is very good for improving the triglycerides. So there are trials of up to 1 year duration in these patients. So that can be safely used for at least for 1 year. Now, the tips to prevent fatty liver disease, as we have already discussed, that one should limit intake of saturated fat and trans fat, quit smoking, eat a balanced diet, exercise regularly, limit consumption of refined carbohydrates. Also, I will say eat much of vegetarian food so as to avoid and particularly leafy vegetables, so less calorie will go. Then limit or avoid alcohol, maintain a healthy weight, takes medicine as prescribed. Thank you.
Thank you, sir, for this wonderful talk. Definitely, this has enlightened us. Now we will take the question from our audience with your permission, sir.
Sure.
So there is a one question is asked by the audience is that when we have to consult the specialist for this fatty liver disease.
A very good question, because fatty liver is so common that every person need not to consult the specialist. But there are certain segments which have high possibility of developing progressive liver disease. Those who have high BMI, very high BMI like 35 to 40 or more, those who have diabetes, those who have family history of liver disease, or they may be those who have associated hepatitis B or hepatitis C, they should consult gastroenterologist at the first go. Then there are certain people uh, whom we can try diet and exercise, and if they do not improve on diet and exercise, if their liver function is constantly going worsen or persistently elevated liver enzymes, then they should consult gastroenterologist.
The one question is asked by Mr. Lata is that is this fatty liver disease is age specific?
No, not age specific. Even we have seen fatty liver in the children. Now, childhood obesity is very common, and we do see diabetes, type 2 diabetes in these patients, and also the fatty liver. And probably it
Yes,
is
sir.
because of the sedentary habits. Now they have more pressure of studies and less space to play.
So, sir, on behalf of NASH 24 by 7, I thank you for this lively and informative talk. So, sir, as you have been emphasizing the awareness for liver health and disease, it is equally important for people affected by fatty liver to regularly visit doctor and continue medications with careful observation and precaution. it is possible to obtain the control of the disease. I would also thank to our audience for their active participation and their patience in making this event successful. I would stay connected with Nest 24 by 7 on Facebook and take care of yourself and your family member. Thank you. Thank you very much, sir.
Thank you. Thank you, everyone.